Welcome to the Core Experience, your connection to community, business, and the people who make it all happen with your host, Brandon Suba.
Well, hello, everybody, all the subscribers and all the listeners out there from the Core Experience here. Great news, ladies and gentlemen. We are back. Little hiatus. I think the last podcast here came out in December 2020. A lot has happened since December 2020. I'm sure we all know, and we're actually going to talk about that on this episode today. But my name is Brandon Suba. I'm the Assistant Vice President, Relationship Manager of Professional Executive. Do you like that title?
Wow, that's really long.
It is. It took me 2 months to memorize it, but I've got it down now. But I have the opportunity to come on the podcast. I have a little podcasting experience beyond my banking experience here. And so I threw my hat into the mix to get this gig. And through many vigorous interviews, I finally got it.
Oh, yeah.
It was one
They were like, you take it, dude.
Pretty much. Yep, pretty much.
That's funny.
So excited to be on here, excited to be the voice of the Core Experience. And we just thought our guest today would be one of the best guests we could have to kick this off.
Oh, man. Are they coming soon? Or?
You're sitting right there. One thing I do want to plug, though, is we do have video on this. So you will have the opportunity to actually watch this podcast if you would like and see Taya, who I'll introduce here in a second, rocking her awesome curly hair. And I put a suit on for today. So we're really making leaps and bounds today. So anyway, well, with no further ado, Taya Gordon,
Hi.
How are you today?
Good. How are you doing? You're pumped up.
I am. I'm excited. Yeah. I'm excited to be doing this. I don't have a bio for you. I just realized.
Oh, I'm actually happy you don't.
Okay, good.
I hate that moment of like, can you tell us a little bit about yourself? Or I'm going to read about you awkwardly right next to you.
Yeah.
I don't know that anybody likes the bio.
I do.
You do?
Oh, I love to hear about myself.
Well, you know why? Because your title is the back and front of your business card.
Jiminy Cripes. I actually have two. You have to get both of them, put them together.
Part A and
title
B.
On there. Okay, well, tell us a little bit about yourself. We're going to dig into your passion here, but just as I believe you're a mother, if I caught that as we were coming in. So tell us a little bit about yourself, just so people know who's talking.
Yeah, sure. So I've been working in healthcare for a super long time. I don't even talk about how long anymore, primarily in like revenue cycle and efficiency and stuff like that. Aside from that, I'm a mom, I'm a gamer. I was born a human, still a human.
Congrats.
Thank you very much. And, most of the time I'm just trying to get people paid in healthcare, which is hard. So that's pretty much me in a nutshell. I don't like to dig in too far, but I mean, if it has to do with money and healthcare, I probably know about it and can help.
You're the go-to. I like that. Well, we are going to dig in a little further because you've done a lot for Core Bank, a lot for the healthcare world, of course, but for Core Bank, webinars, you've done blogs. Anything else I'm kind of missing on the surface level?
Well, and sometimes I help with different clients you guys have that'll, cool. They have questions, things like that, that if I can answer them, I'm happy to. I've tell people all the time, I just don't shut up. I co-authored a book. The second one's coming out shortly. I have a podcast dedicated to revenue cycle stuff. I literally
crazy.
Just don't shut up about trying to get docs paid. Like, let's get people paid.
See, and people say I don't shut up, but I feel
I don't know. You've let me speak several times.
See, so thank you.
I think those people are wrong.
Thank you. Well, you can tell my mom and my wife that because those are.
Yeah, I think he's recording it in there for you.
Thank you. Appreciate that. We'll send that out
totally
there.
Good.
So within the healthcare world, what do you kind of find as one of your favorite accomplishments? You talk about getting people money. You talk about a lot of things here. What would be one of your favorite accomplishments you'd want to share to kind of gain that credibility with the listeners today?
Oh, sure. So we're talking like personal accomplishments here.
You can take it any way you would like.
Man, well, I think, when you talk about accomplishments in the healthcare industry, it's not just one of us. We're all pretty much pulling together, which is the beauty of working in the healthcare industry. And I think a lot of people in the public got to see that during the pandemic. We were all pulling in the same direction. And when you have that happen, you kind of create your own current. And so things get done faster. So one thing I'm extremely excited about and kind of proud of everybody in the industry for doing, not a lot of people outside of healthcare know, but technology-wise, we're like 20 years behind.
Really?
We're still heavily reliant on fax machines and paper and things that most other industries don't need anymore. And so when the pandemic really kind of hit full force, and we're like, how do we see patients? And I'm like, guess we got to do telehealth. Just the amount of folks across the nation who just jumped on and were like, all right, let's do this. It wasn't like oh, but this is hard, or we don't want to, or oh, I won't show up for work today. Just that gumption and that drive to push forward was so incredibly impressive. And I'm really proud to see that momentum continue to occur. That's been really awesome to see.
What was your experience with the technology before it was kind of forced on everyone?
Yeah, it's been frustrating. To be honest with you, it's been so frustrating because there's a lot of you'll hear me talk about lobbying and things like that just in personal conversations. There's a lot of opacity as it relates to healthcare technology, a lot of systems that are designed specifically to never have that information leave their system in a way that communicates well with any other technology. So it's not uncommon for me to have a client say something like, well, we have 14 different software systems right now because this one doesn't talk to this one, but it can send half of this information to this fourth one. And what you end up with is this huge amount of inefficiency. Things start falling through the cracks. You have gaps. And not only that, but then you add on this layer of, these organizations and companies that are creating the technology have never worked in this industry. And it's so unlike any other industry in terms of reimbursement. You really need people who know what they're doing to be building these products out. And so pre-pandemic, you didn't see a lot of that. You saw a lot of, big companies just trying to enter what they thought was an untapped market. And now what you're seeing is people saying, hey, we need to build something. This needs to be for us, by us. We need a seat at the table for this this conversation, or at the very least, nothing about us without us. Like, we need to be part of this conversation. So that happening now is new, and that's also really powerful.
So talking about COVID, you mentioned the pandemic.
Yeah.
There's a blog that you wrote, looks like January, and you talk about it's coming. The end officially is May 11th is what my notes say.
Yeah.
Dig a little more into that. I read the blog
I'm proud of you.
as the preparation I told you ahead of time. And I like how you broke it out into the teams, the patients, compliance, and financial, like heads up to everyone, kind of with each what you wrote on that. So go a little more in depth on that, because I think to see the end of a pandemic, I mean, is there really ever a definitive end? But to say, hey, things are changing now, because I saw a really funny quote, or not a quote, but like a meme or something on, hey, do you remember that when we used to sanitize everything we brought back from the grocery store and we were scared to, so we've come a long ways, but to say definitive legally or politically, whatever it is, that May 11th, what does that bring to us?
Yeah, it's funny because I think that kind of outside of healthcare, when the news hit, it was like President Biden announces the end of the public health emergency. People were like, "Oh, COVID's gone on May 11th."
Magic!
Guys.
Woo!
Yeah, that's fantastic. Did you know that? But really, in healthcare, it's huge for us because there's so many leniencies that were tied to that. So actually pre-pandemic, for example, if you had a patient who had Medicare health coverage and you wanted to see them via telehealth, you could only do that if their originating site, like where they were for the visit, was a doctor's office. So if the patient was at their home and needed telehealth services, that wasn't reimbursable to the physician.
Oh.
And you can see why that makes no sense.
Right.
So like, hey, if you really are incapacitated, or you have ambulatory issues, or you have a low immune system, right? You have immune system challenges. I do, right? It's struggle out here. We understand that, and we'll see you via telehealth, but only if you go to the doctor's office to initiate that. And the reason makes sense. When this was initiated, it was because that was to see specialists that were nowhere near you. And they were saying, if you absolutely need to have this type of a service, it's because you're like in a healthcare provider shortage area, right? But now when you can see anybody on like an Amwell or a Teladoc, it made no sense. And really, it was almost like punishing patients who were on Medicare. And so during the pandemic, the government was like, we have an opportunity to tie into this public health emergency and say, no, regardless of where patients are, you can take care of them, not just for medical health, but also behavioral health. And I can't tell you how big that is for patients who are depressed or any other real, mental behavioral health challenge. Sometimes just leaving and going to a facility is that impossible task for them. So being able to have that expansion, like you can see people anywhere now, you can go to where they are and see them now, was so big. So to know like, hey, the end of the public health emergency means we can't do that anymore, right? Because none of this was finalized. So it's things like that where you're like, okay, so what does that mean for healthcare? And what does that mean for the processes that we've been doing? And for the staff, maybe I hired staff in the last 3 years and they didn't know that that was ever a thing. So it's a huge kind of upending for practices now to try to revert back to what they used to do.
Do you see practices not planning on going back to what they used to do? Are they going to continue to utilize the telehealth and continue to, like a better term, push to make this more of a thing? Because reimbursement's huge in everything that a doctor does, right?
Absolutely.
Because it's not, rarely do you go to the cash register at the end of your appointment and pay them. It's all insurance and behind the scenes. So what do you see kind of the future of those that don't want to lose all the new stuff we brought in?
So it's nice because we're seeing a lot of people push back. And when I say we, it's because I sit on various government affairs committees and councils. I have lobbied before when I was back in the Maryland, like DC metro area. I was lobbying for change. I'm a big advocate of if it's painful to you, tell them. A lot of people don't know how easy it is to get laws changed when you just tell them like, hey, this could be done easier. And so I'm hugely excited about the number of people that have been pushing back and associations. There are hundreds of letters going back and forth to Congress like, hey, we need to keep this. Hey, we need to keep this. And so it is driving momentum. Laws are changing and things are being able to be retained. And the only thing I worry about is that we're going to stay in this box of like, hey, this was great during the pandemic, so we want to keep it, but we're not going to continue to look at what else could we change? What can we keep making it better and better and better? So that's kind of the only thing I worry about.
We got it right away. We figured it out in 2 days, and now it is the way we do it.
Exactly.
So just let it roll.
Exactly.
Interesting.
Yeah.
So either digressing or just sitting where we are, huh?
Yeah, that's pretty much what I worry about. I'm kind of like,
what keeps you up at night.
And it sounds silly, but I just worry that it's like we've been given a menu of like 2 options and it's a ham sandwich and a turkey sandwich. And we're always told like, you can't ever have a ham sandwich. And then we could during the pandemic. And now we're like, we want to always be able to have the ham sandwich. And they're like, okay, fine, you can have a ham sandwich. But nobody's asking about roast beef or vegetarian options, or vegan options. Like, what about the other sandwiches? Like, that's what I worry about.
I like that analogy. That's maybe the best analogy I've heard in 2023 so far.
I have to make healthcare relatable because otherwise people just fall right asleep.
Who doesn't love a sandwich? March is National Women's History Month, and I am a girl dad. I have 2 daughters.
Aww.
I do have a wife still; she hasn't left me yet, and a female dog. So it is all females in my house. And honestly, I have found, I reflected on this one time, a lot of employment that I've had female owners or managers, and I think it's awesome. I think it's absolutely awesome. So do you have any insight about women's healthcare, expanding, maybe addressing it? One interesting fact I learned as I'm learning the healthcare world a lot more is AI brought more opportunity to women, especially in the breast cancer and African-American community, just to help them be seen, if anything else. So kind of expand, not on that specifically, but expand on the opportunity with women's health.
Sure. So I think one of the frustrating, and I love to talk to you about my frustrations, evidently, but
that's what we're here for. Share them.
This is my therapy session. I think something that's really frustrating is that we kind of have these 2, sides of the pendulum where we're either focused on extremely high technology to help us, or we're focused on extremely underserved areas and populations, and we're missing kind of like the middle ground, right? We're missing sort of that delta. And what I mean by that is like health literacy for people is so astonishingly low. So it's oftentimes when I have a lot of female employees, and there's things that I'm pushing them to prioritize that they never would. Prioritize your health, prioritize refilling your own cup. I was blessed with an amazing mentor. I've had a lot of great mentors in my life. One is Lori Bedke. She's local to Omaha. And she's told me on more than one occasion, even though I preach it all the time, I forget myself, like you have to take that time to refill your own cup. And that's so much to do with your health. Women, I think we often feel we need to be everything to everyone. We have to take care of the kids. We have to take care of the household. We need to keep the husbands happy. We need to do the jobs. We need to catch up late at night at work, and we need to look a certain way and dress a certain way. It's one of the reasons why I told you, hey, if I'm on here again, I'm probably going to be in a hoodie, because I think we need to normalize that we don't need to be everything to everybody. And for so long, women were in this just kind of constant momentum of trying to prove ourselves as equals. We're still trying to prove ourselves as equals.
Definitely.
But that shouldn't have to come with us, wearing high heels and skipping mammograms and skipping our annual women's wellness exams. Most women skip their women's wellness exams, not because they're uncomfortable, not because of the copay, but because either they don't know they're supposed to be getting them, or because they prioritize something else over it, like work, their spouse, or their children. And so what we're really doing is there's a great sculpture. I don't know if you've ever seen it, of it's a mom like pulling chunks of herself out to her and giving them to her family. And that's very much what we do as women, and particularly in healthcare, because unlike other industries where you have maybe a list of what you're trying to do, or you have clients that you're trying to take care of, when you have patients who are genuinely ill, whether you're at their bedside or you're trying to get something covered for them, or you're just cleaning up the room after them, as a woman and a caregiver, it is so emotionally draining. There's so much burnout. You can hear in my voice. I was sick last week, and we pushed this podcast. Thank you for that, by the way.
Oh, of course.
Me 5-10 years ago, never. I would have shown up here deathly ill. And I know now, like that, why? Like I said, I was born human. I'm still human. And I think that's what women fail to do in healthcare. That is the biggest detriment, not only to themselves, but to everybody else around them. If I'm healthy and happy and I've refilled my cup, I'm a way better employee.
My wife and I were actually just talking about that concept of, when you're sick and you cancel or you don't go into work, or what that looks like. And it was a harsh reality for me. I did this tiny, tiny stint of making phone calls, selling. It was short because, if you know me, I don't fit well in that little box, literally the cubicle box. But there they pushed, if you're sick, don't come in, because you're going to infect everyone else. And then I think when COVID hit, we got a whole nother sense of, don't go and affect everybody else. And even if that's not the driver, I am impressed with how people are taking care of themselves first, or saying, listen, I'm not going to be your best guest on the podcast today. Can we push this out? Do we have any opportunity? What's frustrating is when the person on the other side isn't the nicest about it. Like, great. Well, then you get sick and you deal with it. But I really do feel that sense of people filling their own cup. I like that you say it that way. Really came about when we had to take care of ourselves, when we had to, I hate to say this, but avoid other people to a certain extent.
For sure.
And I like seeing that in the workplace, because now you're seeing cultures of companies saying, yes, we support this. I know there's some companies, they have unlimited PTO. And at the end of the day, old school, that sounds crazy, right? Like, no one would ever go into work.
Never happen.
No, but now it's an advantage. You're bringing employees in, and because they have it, I've seen more statistically, they don't use it.
No, they don't. And I have, so we do that where I'm at now.
Oh, cool.
All of my employees, it's very flexible hours. Work when you're at peak. Everybody has different peak hours. For me, it's typically late at night. And so if I can return emails then, and I've set that tone, like, I don't expect you to respond to this.
Correct.
That sort of thing. It's beautiful. But I recently hired a new employee. When I was telling her, I want you to take time. It was her first day. She called, and her voice almost sounded like mine. She was deathly ill. And I was like, why are you here? I told you, we're flexible. Go rest, please. Rest today, rest tomorrow. Touch base with me tomorrow afternoon. Let me know how you're doing. And she just burst into tears.
Wow.
And it was on a Teams call. And you can probably tell, like, I get emotional about it, but she has autoimmune issues. I have autoimmune issues. And she said, I've never been told before that I could just get better.
No, and I'm
Like,
sure her
how
previous
sad is
employer wasn't
that?
that way. It is.
Like,
And well, even then when sick people come in and infect the whole
yeah,
I don't know, area that you're in or the whole floor that you're on, I mean,
yeah.
now you're slowing everyone else down. What if
Mhm.
you just hang home, give it
Yeah,
a day, recover, take care of yourself?
exactly.
Can you share and you've shared a lot of what did you say your pet peeves, your
Frustrations. Yeah, you said
frustrations?
it nicer. Let's go with pet
Pet peeves, you like
peeves.
that?
Yeah, it's better.
Okay, so any hot topics in the healthcare industry, though? I talked a little bit about AI, and I didn't know that was such a hot topic. You kind of touched a little bit about telehealth,
Yeah.
which they're not the same thing. I'm sure they share some, but they're not the same thing. So, what's another hot topic or pet peeve of yours that you are dealing with on the medical side?
So, one of the things that I see a lot, I have a lot of clients, and one of the things I see a lot when I'm going in to do assessments and things like that is their lack of support for their own team, which it's
Doesn't that kind of just go right back to what we talked about in the culture and all of
kind
that?
of, but so I often get clients come to me and they're like, we have all of these denials. Why are these claims getting denied? We submit them and we've resubmitted them and the payers aren't paying them. And the payer guidelines, there are problem payers. Hands down, there totally are. There are people out there and payers out there make you want to bang your head into the desk. But for the most part, their guidelines are all available online. And they are telling you when they deny something, why they've denied something. And all that information is readily available. Not only that, but you have a contract with them that outlines why they're going to do what they're going to do. So usually it's all right there for you to understand. So we go in and we tell them, and 92%, this is not my statistic. This came from Accounting Matters and it's in one of the blogs, but 92% of denials are generated from the front desk, and they're due to front desk entry errors. And so what we see a lot when we start going back to clients and telling them that is like, clearly I have idiots at my front desk. And no, in fact, you have humans at your front desk. And I'm going to assume you've never worked at the front desk in a medical clinic. You tell me if I'm wrong. Okay.
Right.
But it's very hard. It's incredibly hard. So you have patients coming up to the front constantly, wanting to check in, wanting to know when they're going to be seen. Is their doctor running late? The phone is ringing, faxes are coming in. The provider wants their next patient back. The MAs want patients back. People want to know where their prescription refills are. Can I give you a copay? Why do I have a balance due? And it's constant. Most of the time, they're taking half of their lunch. If that, they're usually understaffed because there's a huge shortage of qualified employees. And they are working after patients are gone for the day just to try to close out the day. And you're going to tell me that during that time, they're not allowed to fat finger the keyboard once? They're not allowed to flip numbers around once? It's going to happen. That is a high pressure position. They don't have time like carved out for them. And I'm not saying that physician time is easier. They have their own challenges that they have to deal with. But for documentation, that time is theirs. So we understand, right, why these issues happen. So what we need to do is be supportive, find technologies that help them. Look at the technology that we're using and make sure we've given them the education, the resources to use that technology correctly. And that's what's not happening in a lot of places. So that's a huge pet peeve of mine because I go in knowing, I know for the majority of the places I go in, 99.999% of them, your problems are stemming from issues at the front desk. And when we get into them, you're going to tell me that the problem is your employees. And the majority of the time, it is the processes and the training. Because any problem you have, it's either people, processes, or training, right? With the front desk, it's usually processes and training.
Outdated systems too?
Yeah. Or just flat out not knowing how to use them.
Sure.
I mean, I've seen them like, oh, if this symbol is green, it means we verified eligibility, and then we bring in a rep for the software and they're like, no, if it's green, you have the information necessary to run it.
Oh.
But it's actually never been run. And then we get all these denials. Patient wasn't eligible. And the staff's like, we ran it. No, you didn't. Like, and that's not their fault. They were never taught.
And is it one of those situations where they have, get a new system? We've got 3 employees here. They came in, they do an all-day training, we'll say, right? So you lose a day at the practice, all-day training. You've got it all now.
Yeah.
A year later, all new people, you're being trained by the doctor that was trained by one person, or
Exactly.
or I love this, the person that's leaving is going to train you.
Yeah.
And I don't think that's always the best. And so then it's really just, like you said, lack of knowledge, lack of training. Where's the solution for that?
Honestly, it is through, like we were talking about, culture and collaboration. If you don't have a culture where people can bring questions and they can bring, advice and suggestions, that is one of the biggest points of failure. Is practice administrators or leaders who don't want advice and suggestions. If you're not sitting at that desk 40 hours a week, you have no right telling them that it's not hard and that is the best way to do it. You need to hear from them, listen to them, because most of the time, and it's a shame to say this, but most of the time when I see these issues and I go in and talk to the front desk, like, how do you think it could be done differently? They're like, well, there's a field over here we never use. And if they'd let us use that field, it would be way better. And I go back to the software vendor and they're like, yeah, that's what that field is for. And I go back to the practice administrator and they're like, nobody ever told me this. Why did nobody ever tell me this? And I'm like, can we skip the why did nobody ever and just move on to this is freaking awesome and we're going to implement it. You guys are rock stars. Let's go. Like, let's just change the motivation. This is a carrot moment. This is not a stick moment. Stop beating the front desk.
So we've talked about pet peeves. We've really covered the healthcare world. You have your own podcast on challenges. What's exciting? What's the big things coming in 2023 in the healthcare industry?
Honestly, probably awareness. Awareness. I think during COVID, when it was really, really bad, that was when the public started to become aware of issues in healthcare. And what I've started to see, and I'm going to try to stay off the soapbox, you know how I get.
This is exciting. So if you can have soapbox, it's okay.
Right? I'm starting to see big payers and big pharma be held accountable for cost in a way that we have never seen before, that we have been struggling to see. And the public more aware of things that they didn't know before. Like, we can submit a claim to an insurance company and say, hey, we'd like to be paid $100 for this visit. And they'll say, well, actually, we agreed to only pay you $80. But the patient hasn't met their deductible, so you have to get that from the patient. And the patient never returns their call and the doctor never gets paid for that visit. That happens all the time.
Wow.
Also, they say, okay, the patient has met their deductible. We're going to pay you the $80 we agreed to. And then a year later, they say, we want to review the records, make sure you earned that. And they say, no, we saw a couple errors in your documentation. We're taking the $80 back. That happens all the time. This is a regular occurrence in healthcare.
That's crazy.
And the awareness now in the public forum of like, no, doctors aren't all rich. They're not all just rolling in money. That is the most exciting thing for me, because right now it's been an uphill battle for a long time, but now I feel like it's like we're building a snowman, like the snowball's starting to pick up more snow. And I'm like, oh man, by the time we get to the bottom of this hill, or the hill, with all of this gigantic snowball behind us, then we can actually affect real change. And that's what I'm after. Like, let's get people paid. Let's make it transparent. Let's make it easier to access care. It shouldn't be this hard.
And this awareness, it's more focused on, I feel, from what I heard, third parties, not the doctors running the practice, but outside of the things needed to run that practice.
Doctors and the insurance companies, they all know what's going on in healthcare today. And I don't want to bash all of them. A lot of the insurance companies are working with providers on a regular to try to help them get paid more. You have value-based programs that are trying to help them get paid more. But then you also have these weird situations. Like, I remember when I worked I ran a neuroscience clinic or neuroscience center in Maryland, and we gave Botox injections for migraines. And you could only buy the Botox in 200 unit vials, but you could only inject 155 units. So you always had 45 units of waste, but we had to purchase a 200 unit vial and we were not reimbursed for the waste. And there's nothing as a provider you can do about that. And if Big Pharma had decided, for any similar medication that they wanted to, now we're going to send 220 unit vials, they could just do that. There's no law against it. And so now Medicare's just started looking into that for these single-use meds. How much is wasted? How much is not wasted? And so I've been teaching, like, hey, there's a mandatory modifier coming out. A Jay-Z modifier comes out July 1. I love that name.
So that's not your term. That's the actual term.
I was a teen in the 90s. And
Jay-Z?
Yeah. The modifier is Jay-Z. And you have to report. You have to report. And the reason is so that they can start holding them accountable. And so maybe I shouldn't say awareness as much as accountability. Like, we're trying hard in healthcare. We're trying hard to get paid. We're trying hard to take care of people. We're trying to keep good people, and we are all struggling. And so that awareness and accountability, that is the most exciting thing. I'm ready for so much positive, disruptive change in this industry. That's what I'm pumped for.
Okay. Well, we're going to end with that as your kind of your final
Sure.
thought, unless there is one more thing that you're just like, people gotta know.
People gotta know. The only thing I tell everybody is that if you're a gamer, it's okay to be a gamer, and you should spread that awareness. People game in revenue cycle management. Have you seen that? They gamified it.
No.
They gamified revenue cycle management. Check out Sharp Healthcare. If nobody's looked at it, check it out. It did powerful things. Gaming it and providing those like credits to you did a good job. You crushed this. You knocked it out of the park.
Okay. I can relate to that. I've dealt a lot with adult education, online adult education, and it's all about that. You've completed this course, you've earned this, and then you can have competitions with people in the office who has more points and all of that.
Exactly.
They've done that on the revenue cycle side.
Yeah.
What does it look like? Like, is it?
It's very similar. It's like, hey, you worked this many claims. Hey, you had this many clean claim submissions, or
Cool.
yeah.
I think it goes back to, I know not everyone should get a first prize ribbon, but we like to be recognized for the efforts that we're putting in.
Of course.
And I think going back to that person at the front desk, I mean, they're beat up all day long.
Yeah.
Might be nice to get a little pop-up saying, hey, you earned an achievement today. Because that may be the only one they hear.
In the thick of it, you don't see the progress you're making. So yeah.
Wonderful. Well, Taya, thank you so much for your time today. You're rolling back the podcast. I don't think we could have picked a better first guest, especially as we are focusing a lot on healthcare banking. And we too want to be part of that solution and part of the positive world that they have to deal with, other than a lot of your pet peeves, as we decide to call them, right?
Yeah.
All right, everybody. Well, thank you for listening today. I hope you enjoyed as we are reviving the podcast here at the Core Experience. Of course, brought to you by Core Bank. I am going to be your host for as long as they'll let me, Brandon Suba here, but we always look forward to talking to you on the next podcast.
Thank you for listening to the Core Experience, your connection to community, business, and the people who make it all happen. For more details, go to corebank.com/podcast or email coreexperience@corebank.com. Brought to you by Core Bank, member FDIC.